Cannabis was a commonly used legal medication that was part of the set of medications used by physicians in the 1800s. By 1850, marijuana as treatment for numerous afflictions, including neuralgia, tetanus, typhus, cholera, rabies, dysentery, alcoholism, opiate addiction, anthrax, leprosy, incontinence, gout, convulsive disorders, tonsillitis, insanity, excessive menstrual bleeding, and uterine bleeding, among others. The Marijuana Tax Act was passed in 1937 and it criminalized possession of cannabis except for people who had a prescription from a physician. Physicians slowly turned away from the use of cannabis because of the complex requirements of the law. It was just easier to use drugs produced by pharmaceutical companies. Marijuana was removed from the U.S. pharmacopoeia in 1942, thus losing its remaining mantle of therapeutic legitimacy. Over the years since that time, great effort has been put forth to reclaim the right use of cannabis for medicinal purposes. The interesting thing about cannabis is that it does not have the long list of side effects that are common to most pharmaceutical medications. There is no fatal overdose because there are no receptors in the area of the brain where respiration is controlled. There are receptor sites in the brain that responds to both the naturally produced human endocannabinoids and the substances in cannabis. These substances, whether endogenously produced in the body or supplied from a plant, can address problems with pain, memory, learning, anxiety, motor coordination, appetite, nausea, vomiting. All these compounds working together create an entourage effect of the whole plant. CBD and THC are only two of the many cannabinoids found in cannabis. Terpenoids are the essential oils in cannabis, which have anti-anxiety, anti-inflammatory, and many other medicinal effects. Endocannabinoids, those we create ourselves, are essential to fertilization, growth of the fetus, and survival of a newborn. Embryonal implantation into the uterus requires a temporary and localization reduction in one of the most common endocannabinoids present in the brain, anandamide. The endocannabinoid system is responsible for neural development by regulating stem cell differentiation in neurons and by guiding axonal migration and synaptogenesis, making the right connections. Anandamide protects the developing brain from naturally occurring trauma-induced neuronal loss. Suckling initiation in the newborn, which is critical to survival, is stimulated by activation of the CB1 receptors in the neonatal brain. The essential involvement of the endocannabinoid system in pre- and postnatal development not only increases the respect for the role it plays, but may also increase concerns about introducing phytocannabinoids into the mix. Whole plant. The cannabis plant is known for its multiple uses. The leaves, flowers, seeds, stalks, and resin glands have all been exploited for food, fuel, fiber, medicine, and other uses. All these compounds, cannabinoids and terpenoids, working together create an entourage effect. Raw cannabis in form of fresh vegetable juice does not make you high. You can tolerate 60 times more cannabis than you can if heated. It is not psychoactive until humans alter it chemically. It is a dietary essential that helps all 210 cell types in the human body. The THC in the raw form is a phenomenally beneficial substance, but when it is heated, the tolerable dose drops from several hundred milligrams to 10 milligrams. The plant can do phenomenal things, but not if it drops to 10 milligrams. With 10 milligrams, you stimulate the CB1 receptor. You get a psychoactive effect, either dysphoria or euphoria, but you walk away from 99% of the benefit, which are bulk restricting intestinal function, neurological function, inflammation control, and cancer prevention. Raw cannabis juice is an effective and potent method of ingesting cannabis. It is incredibly rich in antioxidants, essential fatty acids, vitamins, minerals, and other nutrients. Medicinal benefits are 2 to 4 times more potent than inhaling and ingesting medicine and other forms. It is also the most concentrated and bioavailable form of THCA, the raw form of THC, which is one of the most effective anti-inflammatory agents known. Drinking raw cannabis juice daily can alleviate symptoms and provide healing for disorders such as various cancers, lupus, Parkinson's, and other inflammatory and autoimmune diseases. The roots of the cannabis plant have a long history of medical use stretching back millennia. The therapeutic potential of cannabis roots have been largely ignored in modern times. A decoction of the root in water could be used to relieve stiffness of the joints, soothes muscle, gout pains, and rheumatism inflammatory conditions. Cannabis roots treat fever, arthritis, as well as skin burns and hard tumors. There are also accounts of cannabis roots being used to treat postpartum hemorrhage, difficult child labor, taken orally for treatment of spotting, vaginal discharge and difficulty delivery, retention of the placenta, and knocks and falls, sexually transmitted diseases, and gastrointestinal activity and infection. It is not common to hear of people using cannabis roots these days. However, there is a rich history as a medical substance. It can reduce pain caused by broken bones and surgeries. Roots are dried, then ground to form a paste. It can be boiled and infused into tea or tincture and can be made into a balm used to heal wounds or burns. Powdered root is used in poultices and creams to soothe certain skin disorders. It is used as a diuretic to stop bleeding during childbirth and reduce pain from minor injuries, burns, joint pain, and gout. Chemicals within the roots play an important role in protecting the liver. A compound called fredolin was isolated from the roots and is a free radical scavenger with liver protective properties. Other compounds have antimicrobial and anti-inflammatory effects. Cannabis root also contains a small amount of choline. Choline is a macronutrient that is involved in numerous biological processes, including nerve function, boosting energy levels, and brain development. If cannabis roots are being used therapeutically, the source of the root must be carefully considered since cannabis root can accumulate heavy metals from soil, including iron, chromium, and ketamine. The effects of cannabinoids on emotional, cognitive, and psychomotor function vary according to the experience of the user and his or her condition at the time of consuming. In whole plant cannabis, THC content is expressed as THCA, tetrahydrocannabinolic acid, prior to decarboxylation into THC, which takes place when the cannabis is heated during cooking. THCA has anti-inflammatory properties in treatment of arthritis and lupus, neuroprotective effects that are useful in the treatment of neurodegenerative diseases, anti-emetic effects for combating nausea and appetite loss, anti-proliferative effects specifically noted in prostate cancer, and THCA manages insomnia, muscle spasms, pain, and other immune systems. Raw green leaf has a lot of benefit. THCA is one of the major compounds present in the leaf as well as in the trichomes. When you heat the THC acid, it converts from a 21 carbon THCA molecule to THC, which is psychoactive molecule. The THCA is non-intoxicating. In the unheated plant, there are 14,500 units of THCA compared to 90 units of free THC. Upon heating, you completely convert, removing the carboxylic acid group. You decarboxylate THCA into THC, and suddenly you have over 10,000 units of THC. Heating increases the THC content from 90 to 10,000. Heating is an effective and complete process, converting the non-intoxicating THCA into the psychoactive THC. This is the chemistry behind the difference between the raw plant versus the heated plant. The leaf, being non-intoxicating, is an incredible dietary source. There are two types of leaves on a cannabis plant, the fan leaves and the sugar leaves. Cannabis fan leaves are filled with flavor, resin, and phytonutrients that support wellness and health. Sugar leaves are small leaves that grow close to the cannabis plant's flower or buds during the plant's flowering stage. The cannabis sugar leaves are usually trimmed after harvest to make buds appear more appealing. Sugar leaves are coated in trichomes and contain high levels of cannabinoids than fan leaves. These two types of cannabis leaves are often discarded, but they can be valuable for making nutritious and cannabinoid-infused beverages and edibles that you can make at home, or to amend previously used soil or grow strong and healthy plants. The cannabis plant is highly nutritious, containing significant levels of essential vitamins and minerals, omega fatty acids, proteins, fibers, terpenoids, flavonoids, and of course, cannabinoids. Raw cannabis fan and sugar leaves are great for upping the nutritional impact of green juices. When kept fresh and raw, not dried or heated, cannabinoids in the cannabis plant are found in their acid form rather than their active form, meaning you will not experience psychoactive effects or a high from eating or drinking raw cannabis leaves. Cannabinoids in their acid form, such as THCA or CBDA, provide their own unique benefits through their interaction with the endocannabinoid system. Cannabis juice can be made at home with any type of blender. The raw cannabis leaves and even buds are first pulverized and then hand pressed through a strainer or cheesecloth, which separates the pulp from the juice. Alternatively, a home juicer can be used to add the cannabis leaves to any preferred juicing blend of fruits or veggies. To make 1 liter of juice, soak 1 cup, 10 leaves of cannabis in cold water for 5 minutes, and then add 10 carrots, 2 apples, and 1 pear. Or 10 carrots, half a large beet, and 4 big leaves of kale or chard, and 2 apples for sweetness. Optional, on top of that, you can add garlic or lemon. Cannabis tea is one of the healthiest beverages on the planet. It's loaded with vitamins, nutrients, and antioxidants. People drink it for alleviating everything from morning sickness to stress. Cannabis contains antioxidants that help repair cells and protect DNA from damage. It also happens to be a potent anti-inflammatory, which can help with brain swelling. Brain inflammation is a leading cause of depression and anxiety. By reducing inflammation, cannabis helps the brain to heal itself and overcome damage from stress. Cannabis enhances rather than inhibits lung functioning. Cannabis acts as a bronchodilator rather than a bronchoconstrictor. It decreases resistance in the respiratory tract and increases airflow. THC reduces tumor growth in lung cancer by 50%. Cannabis tea offers an alternative to people who wish to experience the benefits of cannabis without smoking it. If you have a respiratory ailment, this can be especially beneficial. Cannabis supports heart health. Cannabinoids lower blood pressure and improve circulation in human tissue. Essentially, the compounds in cannabis open the arteries by causing them to relax and widen. High blood pressure and blocked arteries are known to cause heart attacks and heart disease. THC has shown to relieve nausea and stimulate appetite. Nausea and vomiting following chemotherapy is one of the best supported therapeutic uses of cannabis. Cannabis tea could also increase appetite. This could be life-changing for chemotherapy patients who are susceptible to deadly weight loss. Cannabis can prevent Alzheimer's disease. A small dose of THC slows the production of beta amyloid proteins, which are the characteristics of Alzheimer's disease. Drinking cannabis tea is simply another way to supply the body with these powerful cannabinoids. For maximum cannabinoid absorption, consider drinking special tea along with a fat source. This will help your body to better metabolize the cannabinoids. THC is strongly psychoactive, which induces a euphoric high. THC may help anxiety, depression, glaucoma, inflammation, inflammatory bowel disease, insomnia, irritable bowel disease, migraines, multiple sclerosis, muscle spasticity, nausea, opioid use disorder, pain, poor appetite, post-traumatic stress disorder, seizures, symptoms associated with HIV and AIDS. THC stimulates the release of a neurotransmitter called dopamine in the brain, which causes a feeling of euphoria. People using THC may experience altered perception of time, feeling of relaxation, heightened sensory perception, increased appetite. THC can be consumed by inhalation, oral ingestion, topical application, and sublingual administration. Inhalation is the fastest method of delivery and produces the quickest psychoactive effects, often within minutes. THC can be inhaled via smoking, vaping, or dabbing. Oral ingestion. THC can be taken by mouth in the form of capsule, edible, tinctures, or oils. While this method of delivery takes longer to have an effect, the drug's effect tends to last longer. Topical application. THC can be included in lotions, balms, salves, oils, and bath salts that are then applied to the skin. The effects of this method are usually localized, which means they are unlikely to have a psychoactive effect. However, such products may be helpful for reducing pain and inflammation. Sublingual administration. THC can also be consumed as a lozenge, spray, or dissolvable strips that are placed under the tongue and dissolved. Coconut oil is used because of its high amount of essential fatty acids, which make it a good binding agent for the cannabinoids, not to mention its amazing health properties. Half of the fat in coconut oil is comprised of a fat that is not frequently found in nature, lauric acid. Lauric acid has been called a miracle ingredient due to its health-promoting capabilities and is present in mother's milk. In fact, it can be found in only 3 dietary sources: small amounts in butterfat and large amounts in palm kernel and coconut oil. In the body, lauric acid is converted into monolaurin, which is a potent antiviral, antibacterial, and antiprotozoal substance. It can destroy lipid-coated viruses, including measles, influenza, HIV, herpes, and a number of pathogenic bacteria. CBDA is 1,000 times more powerful than CBD at treating depression, nausea, and inflammation. It is anticonvulsant, antibacterial, antioxidant, and has cancer-preventing potential. CBD, cannabidiol, may be therapeutic for many conditions, including but not limited to chronic pain, cancer, anxiety, diabetes, epilepsy, rheumatoid arthritis, PTSD, sleep disorders, alcoholism, cardiovascular disease, antibiotic restraint infections, and various neurological ailments. It's non-intoxicating, does not induce a euphoric high, counteracts psychoactivity of THC, calming effect helpful for those treating anxiety and sleep loss, lowers blood pressure, demonstrates promise in treating pain, multiple sclerosis, inflammation, stress disorders, and epilepsy. Health benefits of CBD: it kills or slows bacteria growth, reduces blood sugar levels, reduces seizures and convulsions, reduces inflammation, reduces risks of artery blockages, inhibits cell growth in tumors and cancer cells, treats psoriasis, tranquilizing used to manage psychosis, suppresses muscle spasms, relieves anxiety, relieves pain, promotes bone growth, reduces function of the immune system, reduces contractions in the small intestines, protects nervous system degeneration, autoimmune diseases, inflammation, and rheumatoid arthritis, neurological conditions including Alzheimer's, dementia, Parkinson's, multiple sclerosis, epilepsy, Huntington's, chorea, stroke, traumatic brain injury, metabolic syndrome, diabetes and obesity, autism, ADHD, PTSD, alcoholism, gut disorders, colitis and Crohn's, cardiovascular dysfunction, skin disease, acne, dermatitis, and psoriasis. A dose of THC is 10 milligrams. The dose for CBD are in the thousands to 2,000 milligrams, giving a phenomenal benefit from CBD. Terpenes are the essential oils in cannabis, which have an anti-anxiety, anti-inflammatory, and many other medicinal effects. Terpenes modulate psychological and psychoactive effects in cannabis.